I'm Dr. Elizabeth Arthur, and I'm the owner of Hallandale Dermatology and Medical Spa, as well as the Hair Center at Hallandale. The one thing that most of our patients have in common is the fact that they've actually done a lot of research on their own. They come in, they still have questions. It's my job to really answer those questions and educate them. But they've done a lot of research. They still need to know, one, what's going to work for them. Two, how much is it going to cost? Three, what's the long-term game plan? On our website, we actually do have a guide to hair restoration, which has a lot of different answers in it. The two major trends in the hair restoration industry are neograft FUE hair transplantation. FUE stands for follicular unit extraction. Neograft started this years ago. It really is the standard of care for hair restoration surgery. It differs from the strip method in that we don't want to waste tissue. We are really only extracting out those follicular units in the back of the head. People don't have that big long line scar in the back of their head, so that really is now the standard of care. The other new sort of thing out there for hair restoration is PRP. That stands for platelet-rich plasma. I feel very honored that I actually brought PRP to Rochester. What we do is we take a person's blood, we spin it down in specialized tubes. We know that those platelets are activated with growth factors, and growth factors actually make our cells think that they're young again. So we inject those and microneedle them into the scalp, and that helps our hair follicles produce a better quality hair. So most of the patients that come in for hair restoration are men, usually between the ages of 20 to about 60. That being said, we see an awful lot of women. We also see men younger and older than that. They usually are sort of two groups. One would be a surgical candidate for the neograft FUE hair transplantation, and then the other group would be more medical treatment, whether that be the PRP, the platelet-rich plasma, or topical, or lights. And a lot of those two sort of groups, they're dependent on finances, it's dependent on hairlines, it's dependent on age, quality of hair, area of donor, but that's something that we go over in the consult. We talk with the patient about what their goals are and what's realistic. So I think the one big question that patients often ask is, am I going to look weird? So I think that's everyone's fear. All right. I think the second question is, how much is it going to cost? The third is really, am I going to have to do this again? People really want to know what they're in for in the long term. My job is to answer all those questions, to have a dialogue with the patient, and we come up with a resolution at the end of that consult, what's best for that individual patient. I think we see amazing results at the Hair Center for Hallandale. Patients are very happy. I think they're very happy because we pick appropriate procedures and appropriate things for the appropriate patient. It really is a conversation that we have with the patient, what their goals are, what their means are, what they're looking to do. A lot of patients who come in for a consult already have sort of a preconceived notion of what they want to do for their hair restoration. And then it's our job to really explain to them whether that's appropriate, not appropriate, and really then go forward. I think the advice that I would give to someone considering hair restoration would really sort of be twofold. All right. One, it would really boil down to your interaction with the provider or the doctor. Did that doctor answer your questions? Did they try to educate you? I always feel my job as a physician is to educate the patient, and then let the patient and I sort of make that decision together, what's appropriate and what's not appropriate. But I always give them options. I think that if you go in for a hair, say, transplant consultation, and you really have in your mind that you want a neograft follicular unit extraction, and the surgeon tries to talk you out of that, why is that? Okay. He or she should give you a good explanation as to why you're not a candidate for something, okay? I've seen patients in the past that things have never really been explained to them. And once it's explained to them, they say, now I finally know. Okay, so I'm not a great I'm not a great candidate, but at least I have the answer as to why. So I think one, you have to have a good, comfortable working relationship with that physician. Are they listening to you? All right, are they addressing what your concerns are? It's not my job as a physician to humiliate or embarrass you or anything else like that. We have this technology available. If you're balding and you want to use it, great. If you don't want to use it, great. You know, you're still a perfect person in the way that you are. The other thing is how comfortable you are with the office, okay? Do the nurses make you comfortable? Does the front staff make you comfortable? Are we sort of easygoing? This is sometimes a hard process to go and say, all right, I want to go and have a hair transplantation. You know, sometimes there's a lot of stigma associated with it. There shouldn't be, but there still is. And it's an expensive procedure. So you really want to feel that if there's an issue, and there isn't, but you want to know that people are listening to you and that you have that good rapport with them. I'm Dr. Elizabeth Arthur, and I'm the owner of Hallandale Dermatology and Medical Spa, as well as the Hair Center at Hallandale. I take great pride in our practice. I would be honored if you chose to be our patient. I think that we do a fantastic job. We listen to you. We will talk to you about what your concerns are, what your fears are, and I really do think that we deliver, and I would be, once again, honored to have you as my patient.